Hey everyone, this is Dr. Matt, and in this video I'm going to show you guys a few lumbar stretches and exercises that anyone can do that suffer from lumbar stenosis or chronic low back pain, or just starting to recover from a acute disc hernia or injury. So it is important to remind everyone that you always want to get that checked out by a spinal specialist or a licensed chiropractor before you engage in any exercises. But these exercises seem to be I chose them because they're very simple to do, and they're good beginnings for anyone that's wanting to start to get some stability in their low back. And this definitely is a type of exercise where there's many different modifications for it, and there's always a lot of things out there, but these are the ones that I feel like are the best for most patients.
So let's get started. The first exercise for the lumbar stretches and exercises will be the knee to chest. So it's a very simple stretch that's going to help get the back loosened up so we can start going ahead and doing the other things too. So this one you can start with one leg down or both up. Typically if you've had just a recent back injury or it's hurt, keeping your knees up helps support in the core and keeps pain from happening in the low back a little bit. So the knee to chest starts with taking your knee, grabbing it here, and pulling it up to your chest right there. Now typically I want you to do this at least twice and hold it there for about 30 seconds. And then switch and go to the other one. Pull it up. Now, you want to find a hard surface to lay down on. Some people can't lay on the floor, so doing this in the bed also can be done. Also, anyone that might be having any knee issues or can't grab their knee here, you can always grab it from under here and do the same thing. But you want to hold it for 30 seconds. That's going to help stretch the glutes and everything else in here. The next thing is called the figure four, and it's just like what it's said. So what you're going to do is take your feet. Sometimes I like to do it laying down flat, but you can always prop yourself up. Put the ankle over the knee here. Push that knee down, and always try to bring it up to your body here. And that should stretch the piriformis and actually start opening up the hip joints as well, which helps out. And again, hold this for about 30 seconds. Twice. Switch, do the other leg. Kind of bring it up. And you want to keep the back straight too as you do this. You don't want to hunch over like this. So keep it straight and just bring the knee to you. Now the next stretch is one that definitely helps out me. But do what you can. Some people can only use one knee here, or other people can go all the way around, and this is called the cross stretch. So what you're going to do is lean your hips all the way over, take your hand here, and lean it back the other way. Just like that. And you can also grab your hip, just kind of push that hip point down as you do this, and then go to the other side. And lead this way. That should open up all of this here. And do that at least twice and hold it for 30 seconds. Now the pelvic tilt exercise starts with the core, and it actually starts builds strength in there, and then it actually also helps with the pelvic floor muscles. So all of those things together will help get some disc space opening and helps build some strength around those lumbar issues that people have whenever they have chronic low back issues or stenosis or degeneration in their low back. So what we're going to start with is have our knees up here. Now, we're not going to be using our glutes or our legs in this one. So, as the arch right here in your back, what you're going to do is tilt your pelvis back and then flatten this out. So what you're going to do is tilt it back, bring your pelvis up, and just hold it there. And then come back down. See, I'm twisting my pelvis forward, and that helps. And just hold it there for about 5 seconds. And you want to do that at least 3 times with 15 reps. So 1, just like that. So this is the second part of the pelvic tilt. It's called the dead bug. So as you're holding that pelvis in that tilt position, you're going to take your one leg and your opposite hand as you're doing this, and you're just going to extend it out together as you hold that pelvis down. So you're using your abs very much in this one. And again, I want you to hold this position and come back down. And do that one again 2 times, at least 15 times. So do the next side. So tilt the pelvis, take the hand and the opposite foot, and hold it. You'll really start feeling it in here. Again, 2 times, 15 reps. So the next one is called the bridge. So it's real simple. I want to now use my legs and my glutes, because that's what we're going to be using this time. And what we're going to be doing is driving our legs into the ground as we lift up our torso up and holding it there. So drive here, hold up, and you want to go flat. You don't want to go all the way up or sag, just complete flare up and hold it there for about 30 seconds. And you want to do probably like 5 to 10 reps of this, depending on how you feel or what you're up to with. And then come back up and hold it here. Alright, so the next thing we're going to be, everything we're going to be doing, we're going to be going flat here. So we'll go here, and the first thing that we do are planks. Now the planks, I want you to hold those for at least 10 to 15 seconds each, and we're going to go to the bird dog position from there, and that's going to help with the erector spinal muscles and help strengthen those. So I want, there we go, your back to stay flat, just like this. And then what we're going to do, you can either do it on your hands like this, or you can go flat. But just take your feet and hold it out, and then keep your back so you can like literally put a dinner plate on your back and it won't spill. And hold it there. And you want to do this at least 5 times and hold it there for about 10 to 15 seconds. The next part is all fours here, just like this. And what we're going to do is that we're going to take our right hand and our opposite leg, and we're going to extend them out. So we want to start off by, let's just doing one leg. So flat back, bring the leg out, and then extend the hand. Now, if you want more of a challenge too, you can don't let them touch the ground, bring them up, and then bring them back down, and hold it there. And do that each hand at least 10 to 15 times. So. Just like that. Now, after all these exercises, you want to also, end with a good stretch as well. So what I like to do is go back down here, grab my pelvis here, and just lift up as I'm pushing into my psoas. And it helps stretch it and release at the same time. Alright, those are the last parts of the beginner part of the lumbar exercises for people that have those low back issues that keep on coming up. Definitely stay tuned, because we'll do a part 2 coming up as well. And don't forget to subscribe to the videos, and let me know what you think, and hit that like button too. So appreciate you guys for watching, and above all, stay active and healthy.